Let's go to the Ashanti region next, and the Johnson & Johnson vaccination exercise will come to an end today. On Friday, 50,400 doses were sent to the region to be distributed in 4 districts. Now, the district set up 36 centers where citizens were given the opportunity to access the jab. Love News' Ohiming Teria has been following the process and is currently standing by with the Deputy Ashanti Regional Health Director, Dr. Roxanne Michael Agyei. Hi, Ohiming, what are you learning?
It's been 5 days since the Johnson & Johnson vaccination exercise started in the Ashanti region. We are looking at 4 COVID-19 hotspot districts in the region where health officials say they contribute not less than 60% of weekly infections as far as COVID-19 is concerned. Kumasi, Metro, Oforikrom, Asokwa, Kwadaso are the other municipalities taking part in this exercise. Behind me is a KMA clinic center here in Kumasi Metro. We're finding out from health authorities how the exercise has gone so far. Let's speak to Dr. Roxanne Michael Agyei, the Deputy Director in charge of Public Health in the Ashanti region. So, Doctor, how has the exercise been going so far?
So far, it's been very good. Patronage is very high. And we cataloged from the weekend when we started. And the weekend, it was a bit jerky for obvious reasons, because weekends, people usually will not have time to come out for such exercise. But from the Monday, it's been very, very active. On average, we've been doing about 8,000 to 9,000 doses daily. That's 8,000 to 9,000 people are vaccinated every day. So as it stands now, we've done over 30,000. And though today's official date for completion of the vaccination exercise is likely to be extended to Friday, as long as we have vaccines. We have about 20,000 doses left. And I'm sure by the close of today, we've left about 10,000, looking at the rates of consumption within our region here.
There's this saying that last days are dangerous. Are we seeing this last day, rush in the COVID vaccination exercise?
There's not been any rush. The loads of people you see here, it's all pertained from Monday. As I said earlier on, the weekends was very calm. The weekend was very calm. But from Monday, it's been a bit turbulent in terms of numbers turning up. And since we left with some doses, and the message is also out there that we are going to run out of vaccine, we expect such clamor or such huge turnovers in our various centers. Kwadaso called that they run out of vaccines, and that is all that they have. And they still have some people yet to be vaccinated. So we are trying to mobilize from other areas to be able to satisfy those who have come to queue since morning. So for them, it's likely to close today, because when the 300 people are done, they won't have any more vaccines. The other areas also have equally high number of people turning up to get vaccinated. So that is what we are doing. But we are limited by the number of doses we have, and that is about 50,400, what we receive from national.
It's been 5 days when you started this exercise. Is it not surprising that the 50,400 doses that the region received, we still have some backlog to be covered? That we still don't have people in the queues, so much that they will be ready to be vaccinated.
We have more people than vaccines now. Like I said, it's been 5 days. But the first 2 days, entered the weekend. People usually will not come out because of funeral, Ashanti region, funeral and other festivities will not make people take off their weekends for such exercise. But from the Monday, it's been very, very turbulent. People are all over, and from all the centers, they are always having people queuing up for the vaccine, which is why I'm saying that we're going to extend it a bit so far as we have vaccines. And we are not likely to extend beyond Friday, looking at the rate of consumption that we are doing on the average about 9,000 doses daily. I mean, if you take away what's happening over the weekends, which is extremely very low. From the weekdays, Monday up to yesterday, we knew an average of 9,000, and we have only 20,000 doses left. So if the rate should continue, it means that today, tomorrow, we'll be done with all the doses that we have received.
Let's look at the reaction of this Johnson & Johnson vaccine. Is it the same as the AstraZeneca, vaccine, or probably what has been the response from those who have participated in this exercise as far as the reactions are concerned?
So far, our surveillance system has received reports of only 3 adverse events. And that's not to say that is all, because the surveillance system we use is a bit passive, that it depends on you reporting either to the health care provider or going on the net or using the MedSafe app. And usually, the sensitization was high that people may experience some fever, headache from the vaccination, actually proving that your immune response or your immune system is actually being stimulated by the vaccine. So a lot more people will just want to take it easy, probably get some paracetamol to take and then sleep off because it's minor. But a few have reported, like I said, we've had a report of 3 since we started. 3 out of 30,000 doses.
I see. And what were the specific complaints that they brought to your outfit?
Oh, there were minor complaints, constitutional symptoms like headache, fever, bodily pains, which is not unexpected from the vaccine. The adverse events that are complaints similar to what we experienced with Covishield some few weeks or few months ago.
What are the lessons to be learned as far as the Johnson & Johnson vaccination exercise is concerned going forward?
The lessons first, let me start with the public, that it's always good not to wait for last minute. When we hear of the campaign, the very moment you hear, please go to the various centers and get vaccinated, because as the days run by, the place or the vaccination points become heated because a lot of people want to catch up the last day or last vaccine doses that are left. And for us, the lesson we have learned is maybe moving forward, the next time we have campaign for a particular area, we may have to strategize about our communication because some of the people are coming from other areas, though we may be able to turn away some of them by convincing them they understand, but some still demand, and beyond certain points, you can't push them away. So we still give. Maybe you have to look at how to communicate within the local settings, within the community, so that the people who are eligible for the vaccine, in terms of place, community, they can get a vaccine. Because now if we have more people coming from outside these hotspots, then it tends to dilute the impact we want to have. Because when we're able to vaccinate the people staying within that hotspot, we are likely to bring down the infection.
Now, as you heard Dr. Agyei say, more than 30,000 people from 4 COVID-19 hotspot districts in the Ashanti region have been vaccinated in the ongoing Johnson & Johnson vaccination exercise. Health authorities say Kumasi Metro, Asokwa, Oforikrom and Kwadaso municipalities contribute over 60% of COVID-19 weekly infections in the Ashanti region. Now, Ohiming, you have Dr. Jima Omari Sasu, Metro Health Director of Kumasi, with you to explain why there's a long, winding queue.
Yes, the vaccination exercise is still happening here in the Ashanti region in 4 hotspot districts in the region. As far as COVID-19 is concerned, what we are seeing here is that the KMA Clinic Center is among the 36 centers designated for this particular exercise. Unlike other places, there's so much people, queued up here to be served for the vaccination exercise. There's a long winding queue as far as from the entrance of this particular building right to where we are now, and a lot more people are waiting to be served. Let me find out from Dr. Omari Sasu, the Metro Director for Health. How are you able to manage this whole long winding queue here?
Thank you very much. We have a number of teams working, doing the data entries, and this helps to make the line move faster. We have reassured everybody that those available here will get vaccines for today. So we are cancelling them and giving them the education. It's likely we'll run out of the vaccines today. So today is the last day, mostly for Kumasi Metro, with the COVID-19 Johnson vaccine for today. We are very happy with the turnout, with the media and the education that has gone on from the NCC. They've helped us a lot with educating the community about the COVID-19 vaccine. COVID-19 is real, and we should all continue to observe the protocols. Thank you.
How do you ensure that all these people who have gathered here, you don't mess up at the center? Yes, the numbers are huge. So how would you know that these are the people who came first and have to be served first? How do you manage the situation?
Okay, so we have a queue for the elderly. There are some who are the elderly. We make sure we have priority for the elderly. So we see them, the middle-aged and the younger ones can wait in the queue, and we follow the queue duly. So they make sure there's a team making sure that they follow the queue at its hand. If you are elderly, we give you a priority. We have a team who are managing the elderly who are coming to us.
Other centers, we learned people who have taken part in the the AstraZeneca exercise also turn up to be served. Is that the situation here?
A few came, we've canceled them. So as you come, we give you those who are eligible. So if you are waiting for your second dose, this is not the time. We are reassured that very soon the second dose will also come on. So we've reassured them that they should wait. When the second dose for the AstraZeneca is in, we'll let them have it and inform them for them to come. So they've understood it. So those who are here are those who haven't taken any of the COVID-19 vaccine. We also do we search in our app to make sure you have not taken the AstraZeneca before we make sure we give you the Johnson & Johnson vaccine. Thank you.
So Daniel, that is the Metro Health Director for Kumasi, Madam Omari Sasu, taking us through how they are able to manage these long winding queues at the vaccination center here. I must say it's a very long winding queue. If you look at the number of people who have gathered here, it's an indication that indeed the education, sensitization, asking people to take part in the exercise has gone down well. Just that health authorities say at the beginning of the exercise, the people were a bit reluctant to come for the vaccination exercise. But today the numbers we are seeing here are so huge. And I can tell you, those who have gathered here, they are men and women and elderly who also have a different queue. That's the arrangement put together by health authorities. The arrangement is that once you are here and you've been counted and given a number, definitely you'll be served. The health director did indicate that probably after today, with the KMA, especially at the KMA clinic here, the exercise could come to an end. But at the regional level, we are told there are about 20,000 doses to be given given to people who need them in the region. But beyond what we are seeing in the queue here, the queue is very long here. It goes beyond what I can even imagine. There are people who have gathered here, and I'm not too sure how eager they are as far as this exercise is concerned. Let me find out from the big man here. Chief, good morning.
Good morning, boss.
How long have you been here?
6:30 and 7 o'clock.
Oh, what about Habesa no past 6:30? And now 7.
6:30.
What about 7 more? Now, we have a baby with dear when that's what say bedroom so and son wako.
Yashiyame. Yashiyame. Yachaya watching. To some case, Omapua, Yenia Samka, Yabacho, Dafu for Yaba.
So, this is somebody who has been here since 6:30 a.m. And he says he's been waiting. Once he's here and he's been assured that he will be served, then he's encouraged to still wait. If you look at beyond this queue, beyond the walls of the clinic, there are people who have also queued up, and they are just almost on the roadside. So it's an indication that the numbers are very, very huge here at the KMA clinic. So let me find out from some of the people who are anxiously waiting to be served in this queue. Chief, good morning.
Morning.
Pacho, over Hache.
And maybe 6 o'clock.
Over 6 o'clock. Pacho, if I know if you buy.
If you let me master never.
I don't know if you let me master Bewo Panye or Kumasi.
Stations or more bino a hundred bear me. Into the mamma Bahano.
Now, what he said, Pennyphone can say, Panye drew her. Baby out here and a one or ball panya, and I saw ye, Juma or her, or ball panya, what's here to meet him. What Chamu or and Grupombe say, me and son or Wabahay, and our ball panya, what is and Carbon?
Oh, my shut down tells about it means if you will be at me one. No, Miss Hunsa have metabacrum to me Bahan my own preco.
Okay, so Daniel, this is just an example of what the Deputy Regional Health Director talked about. There are people who are not in Kumasi Metro or within the 4 designated districts, but have decided to come and then take part in the exercise. This particular man came all the way from the Efijako-Abre South District. And when we talk about Efijako-Abre South District, it goes beyond Tafo. Even Tafo is not taking part in the exercise, but he decided to come all the way from this place to come and have the exercise or undertake to take part in the exercise. So that is an example of what the health director actually talked about. Let me say we are getting to the latter part of the queue, and all these people are just waiting to be served. If you look at the distance, we are looking at over 1 kilometer. So all these people are 1 kilometer away from where the vaccination exercise is currently happening. But they are not perturbed. They are very hopeful that indeed they will have the opportunity and the chance to be vaccinated. Let's go out and then talk to the people who are outside the walls of this clinic. Yes. So we are moving outside the clinic, the vaccination center here, to speak to the people who are already in queue here. It's a long, winding queue, very long, winding queue. Chief, good morning. He says we should move to the next person. Let's see. Yes. So we are doing almost 2 kilometers from the main vaccination center here. And all these people you see here are in the queue. I'm sure these women are tired and they are taking some rest down here so that they get the opportunity to be vaccinated. I will say, I don't know to hear.
But I did lie.
Would you lie? Let's say, so did lie, yeah. Lie and I now so here.
Me now or this time, and I am here. To meet me, engine house, I'm sorry.
What would you have said? Don't you be seen?
Oh, you drew Anna as 740. I'm drew.
Oh, okay. So this woman tells me she's actually in the queue, but because she lacks the capacity, the strength to stand in the queue, then she decided to come and take some rest here. So if you look at where she is, she's not the only person here. The others who are in the queue and feel that they don't have the strength to carry on again, so they have to sit down here to take some rest. I must say it's a very long winding queue. We are talking about 2 kilometers away from the main vaccination center here. So we are seeing people standing here. It's almost closer to the KMA circuit court here. And these people are still here. They are still here. And they are still here. Mami, would you say do never do so?
Yeah, sure. Yeah, son said, yeah, do the same and the last day. It's here, say, bet me a do your swap.
About how, what the best don't you say?
Oh, me buy the ancient meeting call. Matter Day Hospital. And I may call Dr. Anna Horn, I said no more ye. It's more I'm said there be as a nippon dogs into member Hannah may measure. See, measure, say bedroom is so.
Why, Obamumu say, we share Curia, Wapa.
I bet mumu cry. A room is so, a room is so, a coffee.
And the Miado was sent our coy and son Obahai.
And be a munu. Me call matter day. And I'm me didn't call Dr. Anna Hall. And I'm before me bad matter. The Dr. Anna know you say no on be see almost and no mamma hunt memra sinchest no me call matter day. To me through on a masaba and me say.
So, baby, I won't pany, what's your soqua? And I say, Uti, Kumasi,
Greek. Metia Greek. And I'm a baby had me say. It's making me a lot of fair from her.
She came all the way from Kwadaso Municipal to take part in the exercise here. Apparently, she's been moving to centers after centers. Now, she's moved to 2 centers already. And when she learns the centers or have been closed, then she has to come down to the Kumasi Metropolitan Assembly Clinic here. But she appears to be the very last person in this queue. Oh, we have 3 more people who have just joined the queue. So it means that she's not the only person or the last person in this queue. And so I must say, Daniel, people are here. There are people who have moved from other districts to these vaccination centers in order to be vaccinated.
Many thanks, Ohiming Teria, for those updates. It seems to be a very, very long queue. A lot of people are eager to get vaccinated, and that is an encouraging sign in itself. I see someone rubbing off, and he's rubbing his arm. He seems to be in pain. I don't know if he just got his shot. Anyway, Ohiming Teria there, coming to us live from